Hello, my name is Abigail Kruger. I'll be presenting on cardiovascular risk in youth because it's an underestimated threat. I'll be going over the poor choices that young people make, the root causes of heart disease, and compare these to young people's habits. That'll lead us into social determinants and their effect on the heart health, and then fun facts. So to start off, I'll be referencing articles addressing risk factors during teen years can prevent heart-related issues in adulthood from Heart.com in 2025, and Adulting is Hard on the Heart from American Heart Association, also in 2025. Both articles suggested that smoking tobacco and marijuana are bad for the heart because the chemicals cause damage to the heart itself and the vessels. Alcohol consumption between the ages of 18 to 30 is common, and this leads to elevated blood pressure. Physical inactivity is becoming common in that age group, and this leads to heart failure. And lack of sleep is another common issue in this age group, which increases chances for cardiovascular disease. Just some continued habits are having multiple sex partners increases risk due to higher stress and other factors. Excessive screen time has become popular, and this leads to inactivity, which leads to heart failure. Physical fights include physical trauma to the heart. Drug use is becoming popular as well. Injectable drugs cause high blood pressure, ischemia, blood clotting, and arrhythmia. Some root causes of heart disease include smoking and physical inactivity, which we already discussed. An unhealthy diet can cause artery clogging and plaque formation. This kind of leads into obesity, which causes high blood pressure, high cholesterol, high blood glucose, and artery clogging. That kind of leads us into bad cholesterol levels. The blood vessels narrow, blood flow decreases, leading to possible heart attack and stroke. And then high blood pressure is similar, narrow and damaged arteries, which strains the heart and leads to heart failure. Socioeconomic status, kind of just wherever you are in the economy, just lack of access, poor diet, smoking, drugs. Family history, if your family has history of high or heart disease, you're more likely to develop this. And then to prevent heart disease, look at diet. Diet's a big one. Consume less alcohol, consume more fiber. Alcohol raises blood pressure. Less fiber, more fats, high cholesterol. Physical activity maintains healthy weight. Not having a healthy weight means high blood pressure and high cholesterol. Smoking damages blood vessels, blood arteries. And then social factors include education, neighborhood environment, and economic stability. So higher education means better cardiovascular health. Drugs and smoking, just exposure to that causes poor cardiovascular health. And then food insecurity, underinsured or uninsured, can also lead to poor cardiovascular health. The ADA app was made in 2011 by a couple of doctors. This is an AI symptom assessment app. There's 50 in-house medical experts, 35 million assessments have already been complete, and 14 million users. This helps you to understand symptoms, manage your health, and find care. According to an article from the U.S. Department of Health and Human Services, Heart Health and Pregnancy 2024, the heart is working a lot harder to pump blood to you and your baby, which leads to high blood pressure and possible gestational diabetes. Preeclampsia and preterm birth are bigger, more scary risks. This can double your risk of cardiovascular disease and possibly affect the infant. So just developing healthy habits and watching for warning signs during pregnancy, labor, delivery, and a couple years after childbirth. Some chronic conditions. The CDC's article suggests conditions such as obesity, depression, high blood pressure are all caused by binge drinking, smoking, and physical inactivity in ages 18 to 34. These are my references, so thanks for watching.